So here we are, week 4, COVID-19 virtual town hall number 4. I want to start by honoring a family in our county that is grieving deeply. On Thursday afternoon, Maeve McKean and her 8-year-old son Gideon boarded a canoe to retrieve a ball. Our fire department's mobilization has since turned from rescue to recovery. I want people to know who Maeve was and what she did. Maeve was the executive director of the Georgetown University Global Health Initiative. She focused her life's work, where we are focused today, on the one thing that is important to every human being on this planet, the one thing that has the potential to bring us together, our health. In the words of Maeve's mother, Anne Arundel County resident and former Lieutenant Governor Kathleen Kennedy Townsend, our Maeve dedicated her life to society's most vulnerable. She said that her grandson Gideon was a loving big brother who excelled at sports, riddles, math, and chess. "My heart is crushed," Kathleen said, "yet we shall try to summon the grace of God and what strength we have to honor the hope, energy, and passion that Maeve and Gideon set forth into our world." Amen. Today's message from me will be a little different and shorter. I am not going to review, as I did last week and the week before that, all of the creative work that our county departments are doing to serve residents. You can sort through all of that information yourself by going to aacounty.org and clicking on the coronavirus link. I do, however, want to thank all employees of the county. They are truly dedicated public servants, and I will continue to thank them every chance that I get. On that note, I want to give a special thanks to the people you're about to hear from. Our County Health Officer, Dr. Nilesh Kalyanaraman, is the commander in this battle. His work and the work of the health department team will save a lot of lives. Our school superintendent is overseeing an extraordinary effort to deliver the education that our kids need without bringing them to school. I can think of nobody better suited than Dr. George Olato to take on that challenge, but he'll be the first to tell you that it's our teachers who will be the real heroes, as they always are. I'm also thrilled to have Christine Feldman here to talk about how our libraries are continuing to educate and engage our residents of all ages, and to boost the morale countywide. So while I'm thanking people, I especially want to thank everybody who works in healthcare, particularly those who work in our hospitals. You are the soldiers in this battle, and we will forever be indebted to you for your service. We must protect you as you protect us. And finally, I want to thank community leaders. Last week, I was asked at this town hall what people could do to help their neighbors. I went back to our community engagement and constituent service staff, we call them CECS, and asked them the same question. The next day, they launched a survey asking community leaders in the county what they are doing. The response was overwhelming. Some told stories of volunteer networks, and others asked for ideas that they could do more of what they could do. We'll be putting out best practices and offering tools to help you engage, but it's up to you. When we say that Anne Arundel County is the best place for all, it's more of a challenge than a fact. I challenge every one of you to make your community or your neighborhood the best place for all. And please let our CECS staff know what you're doing by contacting them at cecs@aacounty.org. On that note, I've noticed some very good things happening. It seems to me that people are being a little kinder to each other lately. Have you gone outside and walked around the block just to get out? Have you talked to a neighbor down the street for the very first time? Have you felt the urge to ask someone you really don't like how they're doing? Have you been thinking about the 9,000 people in our county who filed for unemployment last week? That's the kind of thing I'm seeing all over this county. I did a shift here at the call center this week at the Office of Emergency Management in Glen Burnie. The number here is 410-222-0600. Please call that number, whether you need help or you want to help. But everyone I spoke to was very understanding and very appreciative of anything that we could do for them. I also met with county employees this week at a waste management facility, at a park, at our new donation management center. All of their jobs have changed in some way, and all of them are taking a risk by doing their essential jobs. But none complained. They all showed that strength that comes when people have a purpose. I spoke on Monday by teleconference with the leaders of our hospitals. They're planning a 60% expansion of bed capacity and training their staffs to manage a patient surge beyond what any have ever seen. But they were fearlessly and methodically preparing their teams. Some of us are frustrated and also afraid. How could the federal government have failed so miserably in its obligation to prepare for a pandemic like this when so many experts were demanding action? Why can't I get tested? How will I stay in my house when the bank's forbearance ends in 60 to 90 days and I've lost my income? How will I be able to reopen my business at the end of all of this? How can I take care of my kids or my parents if I get sick? These are very good questions for which there are no good answers, but they're not new questions. They're the same questions that millions of American families have been asking themselves in what most of us experienced as good economic times. What has changed with the coronavirus is that many more people are in trouble. What's changed is that nobody can ignore the suffering. The Community Foundation of Anne Arundel County publishes a report called Poverty Amidst Plenty. It's about poverty in our county that most people didn't see and that government usually ignored. What we're looking at now is more like poverty amidst everyone. Reverend Steve Tillett of Broadneck-Asbury United Methodist Church said last night on the Feed Anne Arundel virtual benefit concert that, unlike before, now we are all in this together. I think he's right. That's why Congress was able to unanimously pass the Coronavirus Aid, Relief, and Economic Security, the CARES Act, that expands unemployment benefits and puts money where it's needed to rebuild our economy after this crisis from the bottom up. That's why the Republican governor and the Democratic General Assembly in this state were able to draft and pass legislation to help working families and small businesses in record time before early adjournment. That's why I was able to call Councilman Nathan Volke, a vocal opponent of my budget last year, and seek his advice a few days ago on how best to build a balanced county budget for FY21 in the face of drastically lower revenue projections. So my message today is that this truly is our moment to be better than we've ever been, to make peace with our adversaries, to give thanks for the grace that connects us, and to build community everywhere, even if that means doing things that just don't feel normal. And I will now make a very public step into the not so normal. You heard yesterday that the CDC is now encouraging us to cover our faces when we're in public. My mother-in-law, like so many other wise and caring people around the world, was a step ahead of the government. She found some old quilting material, sat down at her sewing machine, and created this. Thank you, Sue. I hope you'll participate in this new fashion trend. This is all a part of acting as though you are a carrier of this virus. Stay at home, wash your hands, get plenty of sleep, eat well, and exercise. We need you to be healthy and resilient.